In terms of the initiatives that the Physicians in Training Committee does, we've been charged with basically increasing the hospital pipeline, the hospitalist pipeline, for both students and residents. So a lot of our initiatives really focus on the training and development and basically nurturing them from becoming students to residents and then to early career hospitalists and then eventually, obviously, to our future leaders. So there's a lot of different initiatives that are a part of this committee. Two of the stalwart parts are basically the student scholarship program that we run. We choose basically 3 longitudinal students and 3 summer student scholars every year, and these students basically either work in the in the constrained period of the summertime versus more longitudinal project, which can be over a year, and they eventually present their work at SHM annual meeting. So if you guys go to the RV poster competition, our student scholars from previous years will be presenting their work there, and eventually the goal is to basically move them towards peer-reviewed publication. So the committee is working on revising some of the rubrics that we use to choose students and in terms of which student projects have the most potential to impact hospital medicine. But a lot of our previous student scholars have gone on to publish in peer-reviewed journals. So that really is going to be our benchmark moving forward, and the committee is in the process of reviewing that process. Also new this year is our resident travel grant. So we basically gave residents the choice of basically applying to this grant when they were applying to annual meeting and submitting either research or quality projects or basically scientific work. And the top 10 residents that in terms of abstracts was basically, we looked at 20 of the top abstracts and selected 10 to come to the meeting basically with registration covered as well as $1,000 stipend to cover any travel costs. So that was one of the things that was really successful in our perception, and we're going to be looking at how we're going to be monitoring that program and going forward, because we think it's an opportunity to engage residents from all over the United States to really submit top quality work in hospital medicine. One thing to note is we also have a new student and resident interest group, and that actually we had an application process for students and residents throughout the United States again to apply to create this executive council, which will hopefully inform us as we try to recruit more students and residents into the SHM fold on different types of programming and initiatives that we're going to be able to hopefully bring online and really kind of tailor towards them. And kind of speaking to that, at SHM 18, as well as future SHMs, we have a young hospitalist track, which is typically a half-day track that focuses on issues around trainees, and this can be anywhere from learning how to publish scholarly work to clinical scenarios such as the talk that I recently gave, which was dealing with call night issues and how to approach common problems at night when you're the only one there and pages are flooding in. This is something that we hope will be very tailored in terms of content towards early career hospitalists as well as trainees in terms of trying to apply some really practical evidence-based principles in those areas.